He grabbed her by the arm and shoved her toward the door, right there, in front of everyone. Dr. Ethan Caldwell, chief of trauma surgery, wrapped his fingers around a nurse's arm and pushed her out of his trauma bay like she was garbage. "Get the fuck out, nurse!" he screamed, spit flying from his lips. She stumbled, caught herself, said nothing. And every person in that room looked away because they were afraid of him. But the man on the gurney, the Navy SEAL bleeding out from wounds no one was supposed to know about, he wasn't afraid of anyone. He lifted his head, looked dead at Caldwell, and said a call sign that made the most dangerous men in America go silent. And in that moment, the surgeon realized he just put his hands on the wrong woman. If this story moves you, subscribe now and follow it to the very end. Comment your city so I can see how far this story travels. The call didn't come through normal channels. That was the first sign something was wrong. The charge nurse, a woman named Lorraine who had worked the overnight shift at Memorial Hermann Level 1 Trauma Center for 19 years, heard the military priority line ring and felt her stomach drop. She'd only heard that phone ring once before. That time 3 soldiers came in. 2 of them died. She picked it up. Incoming critical, male, mid-30s, blast and ballistic trauma, blood loss exceeding 40%, 6 minutes out, your best team, now. The line went dead. Lorraine didn't hesitate. She hit the overhead page. Trauma 1 activation, all hands, Bay 3, immediately. And then the hospital woke up. Bodies came from everywhere. Residents sprinted down hallways. Nurses dropped what they were doing mid-sentence. The anesthesiologist on call, Dr. Pham, came through the stairwell door, still chewing his dinner. Monitor screens powered on. Trays ripped open. Blood products were requested before anyone even knew the patient's name. That's what a level 1 activation looks like. You don't wait. You don't ask. You move. Dr. Ethan Caldwell walked in 90 seconds after the page. He always came last, not because he was slow, but because he required the room to be set before he entered it. That was his ritual, his control mechanism. 15 years as chief of trauma surgery had taught him that the room obeyed him, not the other way around. And it always had. He pulled on his gloves with 2 sharp snaps. Status. Danny Liu, a second-year surgical resident who was smart but terrified of Caldwell, read from the intake sheet. Male, U.S. Navy, no full ID yet, blast injury, left lower extremity, gunshot wounds, upper left thigh, lower abdomen, tourniquet placed in the field, vitals are tanking, he's conscious, doctor, and combative. Caldwell nodded once. Open him up, standard protocol, let's move. The double doors blew open. 4 paramedics, 2 men in unmarked fatigues who said nothing and stood at the edges. And on the gurney, soaked in blood and grime that smelled like desert and gunpowder, was Chief Petty Officer Ryan Maddox. His skin was the color of wet paper. His neck tendons stood out like bridge cables. His jaw was locked so tight you could hear his teeth grinding. Both hands gripped the gurney rails like he was holding himself to this world by force. But his eyes were open, wide open, and there was nothing confused about them. Caldwell reached for the field dressing on the left thigh. Standard. You assess, you evaluate, you act. Maddox's hands shot out and locked around Caldwell's wrist. Don't touch it. Caldwell tried to pull back. He couldn't. A man who'd lost nearly half his blood had just pinned a surgeon's arm like it was nothing. Let go of me, I'm your surgeon. And I'm telling you, that tourniquet is the only thing keeping my femoral from painting this room red. You adjust it wrong, I'm dead in 45 seconds. So take your hand off my leg. Caldwell's face went white, then red. Nobody had ever grabbed him. Nobody had ever talked to him like that in his own ER. He ripped his wrist free and took a step back. Sedate him. 2 of midazolam. Right now. Maddox didn't raise his voice. He didn't need to. You sedate me before you secure my airway. I aspirate. There's fluid in my left chest. You hear that crackle? That's not your imagination. Put me under and you kill me. Then you get to explain that to people you really don't want to meet. Danny Lou checked the monitors. He listened. Maddox was right. There was fluid where there shouldn't be. Danny looked at Caldwell. He didn't say anything. He didn't have to. His face said it all. Caldwell saw it, and it burned him. Not because the patient was wrong, because the patient was right. And being corrected by a man on a gurney, bleeding out in front of his own team, was something Ethan Caldwell could not tolerate. "I don't take medical direction from patients," he said. His voice was ice. "You want to give orders, survive this, and go back to whatever sandbox you came from." Maddox closed his eyes, just for a second. When he opened them, he wasn't looking at Caldwell anymore. He was looking past him, across the bay, at a woman standing near the supply cart. Blue scrubs, hair pulled back. No name tag turned forward. She hadn't said a word since the activation was called, hadn't moved to the front, hadn't tried to be noticed. She just stood there, hands still, eyes tracking everything in the room with the kind of calm that doesn't come from training manuals. Emily Carter, float nurse. That's what her file said. Fill in, temporary, nobody. But Ryan Maddox's entire body changed when he saw her. The tension in his shoulders dropped. His breathing slowed. His grip on the rails shifted from survival to something else. Recognition. "Her," he said. Caldwell followed his gaze, saw Emily, saw nothing. "What about her?" "She stays. Don't move her. Don't send her anywhere." Caldwell almost laughed. "You don't pick your medical team. This isn't a request line. And this isn't a game. She stays. She's a nurse. I have a full team. She's not essential." Maddox's eyes didn't waver. "She's the most essential person in this room, and you don't even know it." That was the line that cracked something in Caldwell. Not because it was dramatic, because Maddox said it with the certainty of a man stating a proven fact. Water is wet. Gravity pulls down. That woman is the most essential person here. Caldwell turned to Emily, and what came out of his mouth next, he said loud enough for every single person in that bay to hear. "Get the fuck out of my trauma bay, nurse." He pointed at the door. Emily set down the gauze she'd been holding. She didn't flinch, didn't argue, didn't look hurt. She just turned and took one step toward the door. And Maddox, running on fumes, running on blood he didn't have, raised his voice for the last time. "Don't move her." Caldwell spun. "I said get her out." "That's not just a nurse. I don't care what she is." Maddox locked eyes with Caldwell, and what he said next came out barely above a whisper, but it detonated in that room like a flashbang. "That's Death Star." The room stopped. Not slowed, stopped. Danny Lou's hand froze on the IV line. Dr. Pham lowered his syringe. A veteran nurse named Brenda, 22 years in emergency medicine, former Army Hospital Corps, put her hand flat on the counter to steady herself. "Oh my God," she said, barely audible. Danny looked at her. "What? What's Death Star?" "It's a call sign. Special Operations. Tier 1. Caldwell looked between them. "A call sign? He's delusional. He's lost 40% of his blood. He doesn't know what He knows exactly what he's saying," Brenda cut him off. First time in her career she'd ever interrupted a surgeon. Her voice was shaking. "Doctor, I worked at Landstuhl Regional in Germany. I treated operators coming out of Afghanistan and Iraq. Call signs aren't handed out like nicknames. They're earned. And that one, I've heard that one before. In whispers." Caldwell stared at her, then at Maddox, then at Emily. Emily hadn't moved. She stood at the edge of the bay, 1 foot toward the exit, face absolutely blank. She didn't confirm, didn't deny. She could have been carved from stone. Then, without a word, she turned around. She walked past Caldwell like he wasn't there. She went straight to Maddox's left side, where the tourniquet was tied, where the blood was pooling, where nobody had dared to touch since the SEAL's warning. And she did something that nobody else in that room would have thought to do in 100 years. She applied pressure below the wound site. Not above where the tourniquet held, below, at a vascular junction point where collateral blood flow could maintain circulation to the lower leg without increasing hemorrhage at the wound. It was precise. It was deliberate. It was a technique that existed in no civilian trauma manual anywhere in the world. It was taught in one program, to one kind of medic, the kind who keeps men alive for 8 hours in a cave with no supplies, no extraction, and no margin for error. The heart monitor beeped, then again. The oxygen saturation number twitched, then climbed. Blood pressure stabilized. Heart rate began to steady. Danny Lou stared at the screen like he was watching a magic trick. What did she just do? How did she? Maddox exhaled, long, slow, controlled. His color shifted. The ghost white faded to something that looked, for the first time, like a man who might survive. She knows, he said. She always knows. Caldwell stood in the middle of his own trauma bay with his gloved hands at his sides and felt something crack inside his chest that had nothing to do with medicine. It was pride, and it was fracturing. But Ethan Caldwell didn't process doubt like other people. He didn't pause and reflect. He converted it, compressed it, turned it into something harder. I don't care what call sign she carries. This is my hospital, my bay, my rules. Maddox opened one eye. Your rules almost killed me twice in the last 4 minutes. Before Caldwell could fire back, the ER doors swung open from the lobby side. 2 men walked in, not medical, not police. Civilian clothes, dark jackets, no ID badges. They moved through the ER like they'd already memorized the floor plan. Didn't ask for directions, didn't stop at reception. They went straight to Lorraine at the charge desk and spoke 3 sentences. Lorraine's face changed color. She picked up the internal phone and paged the chief medical officer. Danny watched them. Who the hell are those guys? Brenda didn't look up from the monitors. The kind of people who make phone calls that end careers and start investigations. 4 minutes later, a third man came through the doors. Older, mid-60s, silver hair cropped military short. A civilian blazer worn over a frame that had spent 40 years in operational readiness. He didn't rush, didn't hesitate. He walked like a man who already knew everything that had happened in this room because someone had told him in real time. Rear Admiral Thomas Whitaker, retired from active command, still consulted for naval special warfare, a man whose name was spoken in the SEAL community the way civilians spoke about legends. He'd led operations that would never be declassified. He'd buried men he loved in ceremonies the public would never see. He walked into Trauma Bay 3. The 2 men from the lobby flanked the entrance behind him. Nobody stopped him. Nobody asked who he was. Caldwell saw a stranger in his space and bristled. This is a restricted area. Identify yourself or leave. Whitaker didn't acknowledge him. His eyes swept the room, steady, methodical, the way a man scans a battlefield. He saw the blood, saw the monitors, saw Maddox on the gurney, and then his gaze found Emily. She was standing at Maddox's side, one hand maintaining pressure, face still controlled, still neutral, still giving nothing away. Whitaker looked at her for a long moment, and when he spoke, his voice carried the weight of years, of missions, of things no one in this hospital would ever understand. Death Star. Emily's jaw tightened. A fraction. A millimeter. Admiral. One word, that's all she gave, and it was enough. Whitaker walked to the gurney and leaned down to Maddox. How you holding, Rook? Maddox tried to smile. It looked like pain. Better now, sir. Whole team's here. Whitaker gripped his shoulder. You hold on, son. You're in the right hands. He looked at Emily. The best hands I've ever known. Caldwell had gone through confusion, irritation, anger, and was now arriving at something he'd never experienced before. The realization that he was no longer the most important person in his own room. Someone needs to explain to me what is happening in my emergency room. Right now. Whitaker straightened and faced him. He was 2 inches shorter than Caldwell, but took up twice the space. Dr. Caldwell, I'm Rear Admiral Thomas Whitaker, United States Navy. The man on your table is a Tier 1 special operator, wounded in an operation you will never be briefed on, in a country that will never be named. He is one of the most valuable assets in the United States military. He paused, letting each word land. And the woman you just ordered out of this room spent 4 years as the most decorated combat medic ever attached to DevGru. She has performed surgery in conditions that would make your operating room look like a resort. She has kept men alive with nothing but gauze and her hands in places where helicopters couldn't land, and God himself seemed to have left. Caldwell's mouth opened. Nothing came out. She walked away 3 years ago. Her record is classified above your clearance level. Her identity is protected by people who take that protection very seriously. She chose to work here, in your ER, without recognition, without rank, because that's the kind of person she is. And you just screamed at her like she was nothing. Whitaker stepped forward. 1 step. That's all it took. So here's what's going to happen, doctor. That man is going into surgery tonight. You are going to lead it because that's your job. And she is going to be at that table with you because that might be the difference between him living and him dying. Is that going to be a problem? Caldwell looked at the Admiral, looked at the men blocking the door, looked at Maddox, fading, looked at Emily, steady, ready, already reading the monitors, already thinking 3 steps ahead of everyone else in the room. 5 seconds passed. They felt like 5 years. Prep the OR, Caldwell said. Full team, she's with us. It was the first right call he'd made all night. The gurney started moving. Emily walked alongside, one hand still maintaining pressure, her eyes locked on the monitors. Maddox reached out and found her wrist. His grip was weak now, almost nothing left. Knew I'd make it when I saw you, he whispered. Emily looked down at him. And somewhere behind the mask, behind the years of training and silence and disappearing into a life nobody knew about, something flickered. Save it, Chief. You're not out of this yet. Maddox's hand slipped off her wrist as they pushed through the OR doors. He was right about one thing. He wasn't out of it. Not even close. Because waiting inside that operating room was a wound that no scan had found. A bleed hiding in the dark, in a moment where the surgeon's pride would either break or a warrior would die on the table. And only one person in that hospital had ever seen that kind of wound before. In a place with no lights, no equipment, and no second chances, she was already walking through the door. The OR doors closed behind them at 12:23 a.m. Maddox was transferred from the gurney to the operating table in under 8 seconds. His body was limp now, arms heavy, head rolling to one side. The adrenaline that had kept him talking, kept him fighting, kept him grabbing surgeons by the wrist and calling out classified names in crowded rooms, that was gone. What was left was a man running on borrowed time, and everybody in that operating room knew it. Caldwell scrubbed in without speaking. He stood at the sink with his forearms under the water and stared at the wall in front of him and said absolutely nothing. Danny Lou scrubbed beside him, stealing glances, waiting for instructions, waiting for the tone. Because Caldwell always set the tone. Always. A joke before a tough case. A sharp comment to keep the team on edge. Something. But tonight there was nothing. Just the sound of running water and a surgeon trying to put his pride back together with his bare hands. Emily was already inside. She had scrubbed faster than anyone. She stood at the table on Maddox's left side, gloved, gowned, still as stone, watching the monitors the way a hawk watches the ground. She hadn't spoken since they left the trauma bay, hadn't needed to. Dr. Pham, the anesthesiologist, was working fast. Intubation, securing the airway, the same airway Maddox had warned them about. He slid the tube in on the first pass, confirmed placement, and looked up. Airway secure. He was right about the fluid. Left hemithorax. I'm seeing decreased breath sounds. Nobody responded to that. Nobody needed to say what they were all thinking. The patient had diagnosed himself better than the team had. Caldwell came through the door, hands raised, and a scrub tech gloved him. He stepped to the right side of the table, looked down at Maddox's body, and took one breath. Scalpel. 12:31 a.m. He opened the left thigh first. The blast damage was severe. Shrapnel had torn through muscle and fascia in patterns that looked random but weren't. Caldwell had seen blast injuries before, in textbooks, in case studies, in the occasional civilian accident, but this was different. This was military ordnance, the kind designed to shred human tissue in ways that maximize suffering. He worked fast, irrigating, debriding dead tissue, clamping bleeders. His hands were steady. Whatever was happening in his head, his hands still knew their job. Danny assisted, holding retractors, suctioning blood, following Caldwell's movements the way he'd been trained. But his eyes kept drifting to Emily. She hadn't moved. She stood with her hands at her sides, watching, and Danny couldn't tell if she was observing or calculating. "Retract more. I can't see the lateral compartment," Caldwell said. Danny pulled harder. More tissue came into view. More damage. "There," Caldwell said. "Femoral artery. Partial transection. That's our primary bleeder." He looked at Fam. "How much blood have we given him?" 6 units packed red cells, 2 fresh frozen plasma. "He's burning through it." "Keep going. I'm going to repair the femoral. Once that's sealed, pressure should stabilize." He worked on the artery for 14 minutes. Meticulous, precise. This was what Caldwell was good at. This was where his hands justified his ego. The repair was clean. Tight sutures. Good flow. He checked it twice. "Clamp off. Let's see perfusion." The monitors responded. Blood pressure bumped up. Heart rate came down a few beats. The room exhaled. "Good," Caldwell said. "Now let's look at the abdominal wounds." He moved to the lower abdomen. 2 entry points, small caliber. He opened the peritoneum and began exploring. Bowel looks intact. Liver's clean. Spleen's fine. He probed deeper. "I'm not finding significant abdominal hemorrhage." "Danny, check the retroperitoneal space." Danny reached in with careful hands. "I don't feel anything, doctor. It's dry back here." Caldwell paused, looked at the monitors. Blood pressure had stabilized after the femoral repair, but it wasn't climbing the way it should. 6 units of blood, fresh plasma, and the numbers were holding, but not improving. Something wasn't adding up. "Fam, what's his output?" "Minimal. Kidneys are barely producing." "He's still in shock. Could be residual from the blood loss." "Could be," Fam said, but his voice carried a question mark. 12:58 a.m., 27 minutes into surgery. Caldwell had repaired the femoral artery, explored the abdomen, and found nothing else significant. By the textbook, the major bleeding source had been addressed. Maddox should have been improving. He wasn't. The numbers held flat. Blood pressure 90/60, heart rate 1 to 10, oxygen saturation 91%. Alive, but not recovering. Hovering on a line between stable and falling. Caldwell felt it, that prickle at the back of his neck, the one that every surgeon knows but nobody talks about. The feeling that something is wrong and you can't see it. "Run the suction through the abdominal cavity again. Danny, check the pelvis." Danny checked. "Clear." "Check the diaphragm." "Intact." "Then where the hell is he still bleeding?" The question bounced off the walls and came back with no answer. Emily shifted her weight, 1 foot to the other, the first movement she'd made in 30 minutes. Caldwell caught it. He looked at her across the table. "Something to say?" "No." "Then stand still." She stood still, but Maddox's blood pressure dropped 2 points, 88/58, and the room felt it like a temperature change. 1:07 a.m. Fam's voice tightened. "He's drifting. Pressure's dropping. We're losing ground." Caldwell went back into the thigh wound, checked his repair. Solid. No leak. He checked the smaller vessels around the blast site. All clamped. All cauterized. Everything he could see was controlled. "It doesn't make sense," Danny said quietly. "We've addressed every visible source." Caldwell didn't respond. He was thinking. And thinking, for a man who operated on instinct and authority, was dangerous territory. Because thinking meant he didn't know, and not knowing meant the room could see it. Emily spoke. One sentence. Flat. No emotion. "You're missing it." Caldwell's head snapped up. "Excuse me? There's another bleeder. You're not seeing it. I've explored every cavity, every vessel. There is nothing else." "There is." "Then where? Tell me. Point to it on a chart. Show me a scan. Give me something other than your gut feeling." Emily looked at him across the table. Her eyes above the surgical mask were calm and absolute, and carried the kind of patience that comes from having argued with men in worse situations than this. "It's not in a cavity, it's intramuscular, deep in the left thigh, behind the blast damage, buried in the posterior compartment where your retractors can't reach from this angle." Danny looked at her. "An intramuscular bleed? That wouldn't show on standard exploration." "No, it wouldn't. It's a slow arterial pumper hiding behind destroyed muscle tissue. The blast created a pocket. The blood is pooling in a space that doesn't normally exist. You won't find it from the anterior approach. You have to go in from the lateral side and retract the hamstring group." Caldwell stared at her. "That's not standard. Neither is the weapon that did this to him." Silence. Fam checked the monitors. 85/55. "We don't have time for a debate." Caldwell gripped the retractor in his hand and felt something he had spent his entire career avoiding. The need to trust someone else. The need to step back from his own judgment and believe that another person in the room knew something he didn't. And every fiber of his being, every year of training, every award on his wall, screamed at him to refuse. But Maddox's blood pressure dropped another point. Where exactly? It wasn't a question, it was a surrender. Emily moved. For the first time in the surgery, she stepped forward to the table. She didn't rush, she didn't hesitate. She placed her left hand on the lateral aspect of Maddox's thigh, found the anatomical landmark by touch alone, and looked at Caldwell. "In size here, 3 centimeters, then retract laterally, you'll see it. And if I don't, you will." Caldwell looked down at the spot her finger marked. It was an area he hadn't explored, an area that standard trauma protocols wouldn't direct him to, an area that, from his training, from his textbooks, from his 15 years of experience, didn't make sense. He picked up the scalpel. "If this is wrong and he crashes because I opened another site—" "He's crashing now," Emily said. "This isn't a choice, it's a countdown." Caldwell cut. 1:14 a.m. 3 centimeters. Clean incision through skin and fascia. He retracted the hamstring muscles laterally, just as she'd said. Danny held the retractors. Fam watched the monitors. And there it was. A branch of the profunda femoris artery, torn at an oblique angle, tucked behind a mass of destroyed muscle that had collapsed over it like a curtain. Blood was pooling in a pocket created by the blast, filling a space between muscle layers that no scan would have caught, no standard exploration would have found. A slow, steady, lethal bleed. The kind that kills you not in minutes, but in hours. The kind that lets you think you've won while it drains you dry in the dark. "Jesus Christ," Danny whispered. Caldwell looked at it. He looked at it for 3 full seconds without moving. Because he was looking at a wound he never would have found. Not in 20 minutes, not in 2 hours. He would have closed up the patient, sent him to recovery, and Maddox would have bled out in the ICU sometime before dawn. And nobody would have known why. "Suction," he said. His voice was different now, quieter. Danny suctioned. The pocket cleared. The torn artery came into full view, pumping with each heartbeat, steady and relentless. Caldwell clamped it. His hands were still perfect. That hadn't changed. Whatever was happening inside his head, his fingers knew exactly what to do. I need a 6-0 proline, and more light on this field. Emily was already guiding the suction tip to clear the remaining blood. Her movements were precise, economical, the kind of efficiency that only comes from doing this work in conditions where wasted motion meant someone died. Danny watched her. He'd trained with some of the best surgical residents in the country. He'd seen skilled hands. But this was different. This was a different language of medicine. Faster, tighter, no wasted energy, no wasted thought. "You've done this before," he said to her, not a question. Emily didn't look up. "Hold the retractor steady." Danny held. Caldwell repaired the artery. Suture by suture, the bleed slowed, then stopped. "Release clamp." The clamp came off. No leak. Perfusion resumed through the repaired vessel. Everyone looked at the monitors. 1:22 a.m. Blood pressure, 92/60, climbing. Heart rate, 102, dropping. Oxygen saturation, 94%, rising. Pham let out a breath he'd been holding for 10 minutes. He's turning around, number going the right direction. Danny looked at Caldwell. Caldwell was staring at the wound he just repaired. The wound he hadn't found. The wound he wouldn't have found. "Close him up," Caldwell said. "Layer by layer, standard closure on the abdomen, and pack the thigh with drains. He's going to swell." His voice was professional, controlled, but something in it had changed. A frequency that wasn't there before. Something that sounded, if you listened carefully, like a man whose foundation had just shifted under his feet. They closed Maddox in 41 minutes. Clean, thorough, drains placed, dressings applied. When the last suture went in, Pham began lightening the anesthesia. Maddox's vitals were steady, truly steady. For the first time since he'd come through those ER doors, the numbers said he was going to live. 1:48 a.m. The team stepped back from the table, gowns bloody, gloves peeled off. The silence that follows a surgery where everyone knows how close it came. Caldwell stripped his gloves and dropped them in the bin. He stood there for a moment, looking at the table, looking at the monitors, looking at nothing. Then he walked out. No debrief, no good work team, no acknowledgement. He just walked out. Danny stood there confused. He looked at Emily. She was removing her gown, folding it neatly, placing it in the disposal bin with the same calm she'd maintained all night. "How did you know?" Danny asked. "That bleed, that location, how did you know it was there?" Emily pulled off her surgical cap. Her hair fell around her face. She looked tired for the first time all night. "Because I've seen it before." "In a hospital?" No, she didn't elaborate. Danny waited. She didn't continue. "Where then?" Emily looked at him, young, eager, a good doctor in the making. She could see it in him, the hunger to learn, to understand, the thing that separates the ones who become great from the ones who just become experienced. "In a valley in Afghanistan, 11,000 feet, no OR, no monitors, no team, just me and a man who'd taken almost the same injury from almost the same type of weapon. I found that bleed by feel in the dark while rounds were hitting the rocks above my head. He lived, barely, and I told myself I'd never miss that wound again, no matter where I was." Danny didn't say anything for a long time. "Does Dr. Caldwell know that?" "Dr. Caldwell knows a man is alive who shouldn't be. That's enough." Emily finished cleaning up, washed her hands at the scrub sink, and walked out of the OR without looking back. 2:03 a.m. Maddox was moved to the ICU. Military guard posted, 2 men in civilian clothes at the door, monitors beeping steady, ventilator breathing for him, while his body began the long work of recovery. Admiral Whitaker was waiting in the hallway outside the ICU. He'd watched the entire surgery from the observation gallery above, hadn't said a word, hadn't moved, just watched. When Emily came down the hallway, still in her blue scrubs, still looking like any other nurse on the night shift, he straightened up. "You found it," he said. "Yes, sir. The surgeon missed it." Emily stopped walking. She looked at Whitaker with something that wasn't quite disagreement, but wasn't agreement either. "He's a skilled surgeon, Admiral. His repair on the femoral was excellent. The hidden bleed was something you only find if you've been in the field. He's never been in the field. That's not his fault." Whitaker studied her. "You're defending him, the man who grabbed your arm and threw you out of the room." "I'm being accurate. There's a difference." The Admiral shook his head slowly, a small smile, not happy, more like the smile of a man watching someone confirm what he already knew about them. 3 years, Emily. You walked away from everything. I looked for you. The command looked for you. We didn't know if you were alive or dead." "I'm alive. You're working night shifts in an ER." "Yes, sir." "Why?" Emily looked at the ICU door. Through the small window, she could see Maddox's chest rising and falling with the ventilator. "Because people come through those doors every night who need help. They don't need someone with a call sign. They need someone who cares enough to stay." Whitaker put his hands in his jacket pockets. "The mission in Kandahar, what happened to you over there? What happened to the team? Nobody blames you for walking away." Emily's jaw tightened. The same small movement from before, the only tell she had. "I don't want to talk about Kandahar, Admiral." "I know you don't." "Then don't bring it up." Whitaker nodded. He knew when to push and when to hold. He'd commanded warriors for 30 years. He knew that the ones who carried the most weight were always the ones who refused to set it down. "He asked for you, you know," Whitaker said. "When they stabilized him in the field, when they got him on the transport, the only thing he said was her name. Not your real name, your call sign. He said if Death Star is still out there, find her. Get me to her." Emily's hands, steady through an entire surgery, through a screaming surgeon, through a life or death diagnosis made under pressure, trembled. Just once, just for a second. "Rook always was dramatic," she said. "Rook is alive because of you. Rook is alive because a surgeon swallowed his pride when it mattered. That's the part that matters." Whitaker looked at her for a long time. Then he reached into his jacket and pulled out a card. Plain white, a phone number handwritten on it. "When you're ready, if you're ever ready, there are people who want you back." Emily took the card, looked at it, folded it once and put it in her scrub pocket. "Good night, Admiral." She turned and walked down the hallway toward the elevators. Blue scrubs, quiet shoes. No rank, no insignia. Just another nurse heading back to the floor. Whitaker watched her go. "Good night, Death Star," he said quietly. To no one. To the hallway. To the memory of what she'd been, and the mystery of what she'd become. 2:24 a.m. The ICU was quiet. Machines hummed. Maddox lay still, sedated, his body finally at rest after hours of fighting. The monitors traced green lines across black screens in steady, predictable patterns. And in the observation gallery above the operating room, where the lights were off and the seats were empty, Dr. Ethan Caldwell sat alone in the dark. He hadn't gone home, hadn't gone to his office, hadn't called his wife. He sat in the gallery where Admiral Whitaker had watched the surgery, and he stared down at the empty operating table below, still streaked with blood that the cleaning crew hadn't reached yet. His hands were in his lap, the same hands that had repaired a femoral artery with textbook precision. The same hands that had missed a bleed that would have killed a man by morning. The same hands that had grabbed a woman's arm and shoved her toward a door. He sat there and he thought about every surgery he'd ever done. Every save, every loss, every time he'd walked into a room and owned it. Every time the team had followed his lead without question. And he realized something that felt like a scalpel cutting into his own chest. They didn't follow him because they trusted him. They followed him because they were afraid of him. And fear, in an operating room, was a death sentence waiting to happen. Because tonight, fear almost kept the one person who could save Ryan Maddox silent. Fear almost sent her out the door. And if Maddox hadn't spoken, if that wounded SEAL hadn't used the last of his strength to say those 2 words, Caldwell would have operated alone, missed the bleed, and a man would have died on his table. And Caldwell would have written it up as unavoidable complications. He wouldn't have known. That was the part that destroyed him. Not that he'd been wrong, but that he never would have known he was wrong. He sat there until 3 a.m. Then he stood up, walked out of the gallery, and went to his office. He opened his computer, and he began typing something he had never typed before. A formal request to the hospital board for a review of trauma bay protocols, leadership conduct during critical activations, and the implementation of open challenge policies allowing any member of the surgical team, regardless of rank, to raise concerns during active procedures without fear of retaliation. He typed it with the same precision he used in surgery, and when he finished, he stared at the screen for a long time before he hit send. Because sending it meant admitting, in writing, on the record, that he had failed. He hit send. In 2 floors below, in the ICU, Ryan Maddox slept, his heart beating steady, his blood pressure holding. Alive because a surgeon finally listened. Alive because a woman who had walked away from everything still couldn't walk away from the one thing that mattered, saving the person in front of her. Caldwell's email hit the hospital board's inbox at 3:11 a.m. By 6 a.m., 7 people had read it. By 7 a.m., the chief medical officer, Dr. Patricia Voss, had called an emergency meeting. And by 8 a.m., every senior attending, department head, and nursing supervisor at Memorial Hermann knew that something had happened overnight in Trauma Bay 3 that was about to change how the hospital operated. But the staff on the floor didn't need an email to know. They had something faster. They had Brenda. Brenda Kowalski had been a nurse for 22 years, and she had never once in her life kept a secret that didn't involve a patient's medical record. By the time her shift ended at 7 a.m., she had told 4 nurses in the break room, 2 respiratory therapists in the elevator, and 1 security guard who didn't even ask. And what she told them spread through that hospital like a brush fire in dry grass. A Navy SEAL came in last night. Caldwell tried to throw a nurse out of the trauma bay, grabbed her arm, screamed at her in front of everyone, and the SEAL said her call sign, Death Star. She's former Special Operations, Tier 1, the most elite combat medic the military ever produced, and Caldwell shoved her toward the door like she was nothing. By 9 a.m., people who worked in departments that had nothing to do with the ER were finding reasons to walk past Trauma Bay 3. Lab techs, radiology staff, a cardiologist who claimed he needed to check on a patient downstairs, but really just wanted to see the bloodstains on the floor that housekeeping hadn't fully cleaned yet. And everyone, every single person, had the same question. Where is she now? 8:47 a.m., Emily Carter clocked in for her next shift like nothing had happened. She came through the staff entrance, changed into fresh scrubs, tied her hair back, clipped her badge to her chest, and walked to the nursing station on the 3rd floor where she'd been assigned for the day. Med-surg, post-operative patients, routine. The charge nurse on the floor, a woman named Sandra, looked up when Emily approached the desk and couldn't hide the expression on her face fast enough. Morning, Emily said. Sandra stared at her. Morning, what's my assignment? Rooms 312 through 320. Standard post-ops, nothing complicated. Got it. Emily picked up the patient charts and turned to go. Sandra called after her. Emily, she stopped. Is it true, what they're saying? Emily didn't turn around. What are they saying? That you're some kind of military special ops medic, that you saved that SEAL's life last night, that Dr. Caldwell grabbed your arm and threw you out, and you didn't even... I'm a nurse, Sandra. That's what my badge says. Can I get to my patients? Sandra closed her mouth. Emily walked down the hallway and disappeared into room 312. But Sandra noticed something she hadn't noticed in the 6 months Emily had worked at this hospital. The way she walked. Not fast, not slow, but with a kind of efficiency that wasted nothing. No extra movement, no hesitation. The walk of someone who had spent years moving through spaces where wasted movement could get you killed. How did I never see that before, Sandra thought. And then she answered her own question. Because she didn't want you to. 9:15 a.m., 2 floors down, in the ICU, Ryan Maddox opened his eyes. The ventilator had been removed an hour earlier. He was breathing on his own, weak but steady. The sedation had been tapered through the early morning, and now, slowly, the world was coming back to him in pieces. Fluorescent light, beeping monitors, the smell of antiseptic, pain everywhere, deep and constant, but manageable. The kind of pain he'd been trained to file away in a drawer in his mind and close the door on. 2 men sat in chairs by the door. He recognized them without looking directly at them. Agency. Always agency. They didn't speak. They never spoke first. A nurse came in to check his vitals. Young, male, nervous hands. "Good morning, Chief. I'm Marcus. I'll be your ICU nurse today. How are you feeling?" Maddox looked at him. His throat was raw from the tube. His voice came out like sandpaper on concrete. "Where is she?" Marcus blinked. "Who?" "The nurse, from last night, Emily." "I'm not sure who was on the trauma team last night. I can check the—" "Don't check. Find her." Marcus glanced at the 2 men by the door. They offered nothing. He looked back at Maddox. "Sir, you really should rest. You've been through—" "Son." Maddox's voice dropped to something that wasn't a threat, but wasn't a request either. "I've been awake for 4 seconds, and I've already asked you twice. I won't ask a third time. Find Emily Carter. Tell her Rook wants to see her." Marcus left the room quickly. His hands were shaking, and he didn't know why. There was something about the way that man spoke that made you move. Not because of volume, because of weight. 9:32 a.m. Emily was changing an IV bag in room 316 when Marcus found her. "Excuse me, Emily Carter?" She looked at him. "Yes, there's a patient in the ICU asking for you. Room 4. He said to tell you Rook wants to see you." Emily's hands paused on the IV line, just for a beat. Then she finished connecting the bag, checked the drip rate, and turned to Marcus. "Tell him I'll come when my patients are settled." He seemed pretty urgent about it. He always does. He'll wait. Marcus didn't know what to do with that. A critically wounded special operations soldier was demanding a nurse by name, and she was telling him to wait. He stood there for a second, then nodded and left. Emily finished her rounds, every patient, every chart, every medication check. She didn't rush. She didn't skip. She did her job the way she did it every single day, because that was the point. That was always the point. 10:14 a.m. She took the elevator down to the ICU, walked past the military guard at the door. One of them looked at her, then looked at his partner. A small nod. They knew who she was. Of course they knew. She walked into Maddox's room. He was propped up slightly, eyes open, looking better than any man had a right to look, 12 hours after nearly dying. "Took you long enough," he said. "I had patience." "I'm a patient." "You're not my patient." Maddox grinned. It cracked his dry lips. "Still mean as hell. Good. Means you're still you." Emily pulled a chair to the side of his bed and sat down. She didn't lean in, didn't hover. She just sat, hands in her lap, and looked at him like she was reading a chart, assessing. "How's the pain?" she asked. "About a 7. "It's higher than that." "Fine, 9. Happy?" "No, but honest is a start. Your color is better, vitals look stable, the femoral repair is holding. You're going to keep that leg." Maddox looked down at his left leg under the blanket. He flexed his toes. They moved. He let out a breath that carried 3 years of battlefield luck in it. I felt it, he said. When they hit us, the blast, then the gunfire. I went down and I felt the blood leaving, and I thought, this is it. This is where Rook checks out. But you didn't. No, because my medic in the field, kid named Torres, he got the tourniquet on in under 30 seconds. Good kid, fast hands, and then they got me on the transport, and the whole time I'm fading, the only thing in my head was one name. Emily said nothing. Yours. She looked at the monitors. Your heart rate just went up. Because I'm talking to you and it's been 3 years, and I'm a little emotional about it, if that's allowed. It's allowed, just don't blow a stitch. Maddox laughed. It hurt. He grabbed his side and winced and laughed again anyway. God, I missed you. Emily's face didn't change, but her hands, folded in her lap, pressed together harder. I heard what happened out there, she said, in the ER, before I got to you. Yeah. You told them my call sign. Yeah. In front of everyone. Maddox met her eyes. You were walking out the door, Em. That surgeon was throwing you out and you were going. And I couldn't let that happen. Not because of ego, because I knew. I knew in my gut that if you left that room, I was dead. Emily held his gaze. You put my cover at risk. Your cover. You're not undercover, you're hiding. The word landed hard. Emily's jaw tightened. That tell again. I'm not hiding. I'm living a different life. You're hiding. You walked away from everything and everyone after Kandahar, and you buried yourself in a hospital where nobody knows you, and you convinced yourself that's living. Don't talk about Kandahar. Somebody has to. Not you. Not now. Then when? Another 3 years? Another 10? Emily stood up. The chair scraped back. You need to rest, Chief. I'll check on you later. She stopped at the door. I'm sorry. About Kandahar. About Martinez. About all of it. I'm sorry I wasn't there. Emily's hand gripped the door frame. Her knuckles went white. Martinez didn't die because you weren't there, she said, her back still turned. Martinez died because I wasn't fast enough. She walked out before he could respond. 10:38 a.m. In the administrative wing, the emergency meeting was underway. Dr. Patricia Voss sat at the head of the conference table. Caldwell sat at the other end. Between them, the hospital's legal counsel, the director of nursing, and 2 department heads who looked like they'd rather be anywhere else. Voss held a printed copy of Caldwell's email. She'd read it 3 times. Ethan, this is unprecedented. In the 15 years you've been chief of trauma, you have never once requested a protocol review. And now you're asking for leadership conduct evaluations, open challenge policies, and ego suppression training. Your words. I know what I wrote. I need to understand what happened last night. What happened is I nearly killed a patient because I wouldn't listen. The room went silent. Caldwell leaned forward. A nurse on my team identified a secondary bleed that I missed. I missed it because I didn't look where she told me to look. I didn't look because I decided she couldn't know something I didn't. And she knew it because she has field experience that I will never have, in conditions I will never face. And I dismissed her because of the title on her badge. The director of nursing, a woman named Helen Park, looked at him. Are we talking about Emily Carter? Yes. What is her background exactly? We've been hearing things all morning, but nothing official. Caldwell shook his head. I can't tell you. It's classified. But I can tell you what I saw with my own eyes. She diagnosed a hidden arterial bleed from across the operating table by understanding the weapon that caused the injury. She guided me to it with precision that I have never seen from any colleague in my career. And if she hadn't been in that room, the patient would have died in recovery, and I would have written it off as complications. Voss set the paper down. Ethan, I also need to address the other matter. Multiple witnesses report that you physically removed Nurse Carter from the trauma bay, that you grabbed her arm. Caldwell's face changed. Something raw moved behind his eyes. That's correct. That's assault, Ethan. I know what it is. If she files a complaint, she won't. Helen Park leaned in. How do you know that? Because she's not that kind of person, and that makes what I did worse, not better. The room absorbed that. Voss studied him for a long moment. What do you want to happen here, Ethan? Because right now I have a surgeon admitting to assault and requesting institutional reform in the same email. I need to know if this is accountability or damage control. Caldwell looked at her, and for the first time in anyone's memory, he didn't have a quick answer. He didn't have a polished response. He sat there with his hands flat on the table, and he told the truth. Last night, I was the most dangerous person in that operating room. Not because I'm incompetent, because I was so certain of my own competence that I couldn't see past it. I created an environment where a nurse with more combat medical experience than anyone in this hospital was afraid to speak up until a man's blood pressure was in the basement. That's not her failure. That's mine. And if I don't fix it, the next patient might not have a SEAL on the table who knows her call sign. Nobody spoke for 12 seconds. Voss picked up her pen. I'm going to approve the protocol review, and I'm going to recommend a 30-day supervised return for you with a peer evaluation component, not as punishment, as process. Caldwell nodded. Fair. And Ethan, you need to talk to her, personally, not as a formality, as a human being. I know. Do you? I'm learning. 11:02 a.m. Emily was drawing blood from a patient in room 318 when Danny Lou found her. He was still in the clothes he'd worn for his overnight shift. Hadn't gone home. Hadn't slept. He stood in the doorway and waited until she finished. You want something, Danny? I need to ask you something. Then ask. Kandahar. Maddox mentioned it. Brenda told me there was a mission that went wrong. Something classified. She said that's why you left the military. He hesitated. What happened? Emily labeled the blood tube. Her handwriting was perfectly steady. That's classified, Danny. I know, but I'm trying to understand something. You had skills in that OR last night that I've never seen in 4 years of training. Not from attendings, not from fellows, not from anyone. And you're working as a float nurse drawing blood on a med-surg floor. I don't understand. Emily set the tube in the transport rack. She looked at him. Let me ask you something. When Dr. Caldwell told you to sedate Maddox in the trauma bay, and you knew the patient was right about the airway, what did you do? Danny's face tightened. Nothing. I didn't say anything. Why? Because Caldwell would have what? Yelled at you? Written you up? Made your residency harder? Yes. And because of that, you stayed quiet while a doctor almost killed a patient. Danny looked at the floor. That's not an accusation, Danny. That's a diagnosis. You were afraid. Everyone in that room was afraid. And fear in a trauma bay is more dangerous than any bullet, because a bullet only kills one person. Fear keeps an entire room silent while someone bleeds out. She picked up her supply tray and walked past him. Then she stopped. You want to know why I left Tier 1 medicine and came here? Because in the field, I could speak. My team listened. Rank didn't matter. Only knowledge mattered. And then Kandahar happened. And I lost people I loved. And I walked away. And I came to a place where I thought the rules would be different. Where medicine would be medicine. Where the best idea wins. She turned to face him. And last night I found out it's exactly the same. Ego on top, fear underneath, and the patient in the middle, paying the price. Danny looked at her. So why stay? Emily held up the blood tubes. Because Mrs. Patterson in 318 needs her CBC results by noon, so her oncologist can adjust her chemo. And that matters. It doesn't require a call sign. It requires someone who shows up. She walked away. Danny stood in that hallway for a long time. Then he went to the residence locker room, sat down on a bench, and thought about every single time in his training he had known something was wrong and said nothing. The list was longer than he wanted it to be. 11:47 a.m. Caldwell found Emily in the third-floor break room. She was eating a granola bar and reading a patient chart. She looked up when he walked in. He closed the door behind him. "Can I sit?" he asked. "It's your hospital." He sat across from her. He put his hands on the table, the same table where nurses ate lunch and complained about their shifts. Nothing clinical about it, nothing formal. "I owe you an apology." "You owe your patient an apology. I just work here." "I owe you both, but right now, I'm looking at you." Emily set down the chart. "Okay. I grabbed your arm last night. I put my hands on you, in front of the team, in front of the patient. I screamed at you, and I treated you like you didn't belong in a room that you understood better than I did. And I did it because your badge said nurse, and my badge said chief of surgery, and I decided that meant I was right, and you were nothing." Emily listened. Her face gave away nothing. "You weren't nothing," Caldwell said. "You were the only person in that room who could save him, and I tried to throw you out." "Yes, you did. I'm sorry." "Okay. That's it? Okay?" Emily looked at him, really looked at him, and for a moment Caldwell saw something in her eyes that he hadn't expected. Not anger, not resentment, exhaustion. The deep, settled exhaustion of a woman who had spent years being underestimated and had stopped being surprised by it. "What do you want me to say, doctor? That I forgive you?" "I forgive you. That I understand. I understand. You're a surgeon. You're trained to control the room. That's not a flaw. It's a feature. Until it isn't. Last night, it wasn't." Caldwell swallowed. "You could have fought back. In the trauma bay. You could have refused to leave. You could have told me who you were. And what would that have changed? You would have felt threatened instead of superior. The result would have been the same. The only reason I got to stay is because Maddox said my call sign. He gave you something your ego could process. Credentials. Authority. A reason to respect me that didn't require you to just trust a nurse." That hit Caldwell somewhere he wasn't prepared for. Because she was right. He hadn't listened to her because she was competent. He had listened because a SEAL and an admiral told him she was important. "That's the problem," Emily said. "It shouldn't take an admiral walking into your ER for you to listen to your team." Caldwell pressed his palms flat on the table. "I know. Do you? Because the next time it happens, there won't be a SEAL on the table to vouch for the nurse. There will just be a patient dying and a surgeon who can't see past his own reflection. That's why I submitted the protocol review. I read about that. Open challenge policies. Ego suppression training." She paused. "Good. You think it'll work?" "I think policy doesn't fix people. People fix people. And you won't know if you've changed until the next crisis, when there's no admiral watching and no call sign to save you from yourself." Caldwell stared at her. He opened his mouth, closed it, then opened it again. "Will you help me?" Emily blinked. "Help you what?" "Design the training, the cross-disciplinary protocols. You've operated in environments where ego gets people killed. You know how to build teams that function under pressure without hierarchy destroying communication. I don't know how to do that. I've spent 15 years building the opposite." Emily studied him, looking for the angle, the ego play, the politician's move. She didn't find one. "You're serious?" "I'm serious." She picked up her granola bar, took a bite, chewed slowly, made him wait. "I'll think about it." "That's fair. And doctor, if you ever put your hands on me again, or on any member of your staff, I won't need an admiral to handle it." Caldwell looked at her, and he understood, completely and without question, that she meant it. "Understood," he said. He stood up, walked to the door, stopped. "For what it's worth, what you did last night in that OR was the most impressive piece of medicine I've ever witnessed." Emily didn't look up from her chart. "For what it's worth, your femoral repair was flawless. You're a great surgeon, doctor. You just need to be a better leader." Caldwell left the break room. He walked down the hallway and past 3 nurses who looked away when they saw him. 3 months ago, that would have felt like respect. Today, it felt like what it was: fear. And for the first time, he wanted to change that. 12:15 p.m. Back in the ICU, Maddox was awake and trying to convince Marcus to let him sit up fully. "I've been shot, blown up, and operated on by a surgeon who almost killed me. I think I can handle sitting at a 45-degree angle. Doctor's orders say 30 degrees maximum. Which doctor? The one who missed the bleed or the one who found it?" Marcus pressed the button and raised the bed to 45 degrees. Maddox looked at him. Smart kid. The door opened. Admiral Whitaker walked in. He changed clothes, fresh blazer, same posture, same gravity. "You look like hell, Rook." "Thank you, sir. I feel like heaven compared to 12 hours ago." Whitaker sat down in the chair Emily had occupied earlier. He leaned forward, elbows on knees. "I need to talk to you about something, and I need you to listen before you react." Maddox's grin faded. He knew that tone. That was briefing tone. That was the voice that came before bad news wrapped in calm words. "Go ahead, sir." "Command is going to want to debrief on what happened. Not just the mission, the medical event, how you ended up here, how your identity was handled, how a classified operator ended up in a civilian hospital with his call sign being spoken in front of 20 people. I did what I had to do to stay alive. I know, but you also burned Emily's cover. Completely. Every person in that ER knows her call sign now. By tomorrow, the whole hospital will know. By next week, people outside this building will be asking questions." Maddox's face hardened. "She was walking out the door. If she left, I was dead." "I believe you, but there are consequences. Her identity was protected for a reason. After Kandahar, after what happened to the team, there were people who wanted to find her. Not good people." Maddox went still. "What are you saying?" "I'm saying her location is compromised, and we need to have a conversation about what happens next." The heart monitor beeped faster. Marcus looked at it from the nursing station through the glass. Maddox stared at Whitaker. "Are you telling me that by saving my life, I put hers at risk?" Whitaker didn't answer immediately. That was answer enough. Maddox closed his eyes. His fists clenched the bedsheets until his knuckles went white. Pain shot through his leg, and he didn't care. "Then fix it," he said. "Whatever it takes, whatever resources, whatever strings, whatever favors you have left. You fix it, Admiral, because that woman saved my life last night, and if anything happens to her because I opened my mouth, I will never forgive myself. Or you." Whitaker put his hand on Maddox's arm. "Easy, son. That's why I'm here. We're already moving on it." "Moving on what?" "On making sure Emily Carter stays safe, whether she wants our help or not." Maddox opened his eyes. "She won't want it." "I know. She'll say she can handle it." "I know that too. And she'll be right, but do it anyway." Whitaker stood up, buttoned his blazer, looked down at the wounded SEAL with something that went beyond military protocol. Something that looked like a father watching a son carry a weight too heavy for one man. "Rest, Rook. That's an order." "Since when do I follow orders?" "Since right now." Whitaker walked out. The door closed softly behind him. And in room 316 on the 3rd floor, Emily Carter was changing a bandage on an elderly woman's hand, talking softly about the weather, smiling in a way that made the woman feel safe. Just another nurse on just another shift. But somewhere in a classified file, in a building she'd never see again, her name was now flagged. And a clock she didn't know about had started ticking. The clock she didn't know about had been ticking for 6 hours when the first sign appeared. 2:47 p.m. Emily was charting at the 3rd floor nursing station when her phone buzzed. Not her work phone, her personal cell, the one she'd bought at a gas station in New Mexico 3 years ago, paid for in cash, registered to a name that didn't exist. The phone only 6 people in the world had the number to. 3 of them were dead. She looked at the screen. Unknown number. No caller ID, no location data. It buzzed twice and stopped. Emily stared at it for 3 seconds. Then she set it face down on the desk and went back to charting. Her pen didn't shake. Her breathing didn't change. But something behind her eyes shifted, the way a soldier's eyes shift when they hear a sound that doesn't belong in the silence. Sandra noticed. "Everything okay?" "Fine. Wrong number." It wasn't a wrong number. Emily knew that. A wrong number rings once or leaves a voicemail. 2 buzzes and a disconnect was a signal. Old protocol, the kind used by people who didn't leave traces. She finished her charting, excused herself to the restroom, and locked the door. She pulled out the phone and checked the call log. The number was there. She didn't recognize it. She typed it into nothing, searched nothing, called no one back. She memorized it, digit by digit, the way she'd been trained to memorize grid coordinates and radio frequencies, and put the phone back in her pocket. Then she looked at herself in the mirror. Same face, same scrubs, same woman who'd been invisible for 3 years. But the eyes looking back at her weren't a nurse's eyes anymore. They were scanning, calculating, assessing threat. Kandahar had taught her many things. The most important was this: when the silence breaks, you don't wait to find out why. You move. 3:12 p.m. She went back to the floor and finished her shift like nothing had happened. She gave medications. She changed dressings. She helped an 80-year-old man walk to the bathroom and back and told him he was doing great when he apologized for being slow. She smiled at him and meant it. But every time she passed a window, she looked outside. Every time the elevator opened, she tracked who stepped out. Every time a door closed behind her, she listened for the click. 3 years of peace, 3 years of quiet, and now, because a wounded SEAL had said 2 words in a crowded trauma bay, the walls she'd built were cracking. 4 p.m., her shift ended. She changed out of her scrubs in the locker room, put on jeans and a gray pullover, and walked toward the staff exit. She pushed the door open and stepped into the parking garage, and stopped. A man was leaning against the concrete pillar next to her car. Mid-40s, athletic build, dark jacket, hands in his pockets. He wasn't military, she could tell by the way he stood. Military men stand like they're ready. This man stood like he was comfortable, confident, the posture of someone who operated in a world where badges and uniforms didn't exist, and authority came from information. "Emily Carter?" he said. She didn't answer. She shifted her weight to her back foot. Her car keys were in her right hand, the longest key positioned between her index and middle fingers. Old habit, automatic. "My name is Cole Brannigan. I work with Admiral Whitaker. He asked me to find you." The Admiral knows where I work. He does, but he thought a conversation in a parking garage might be more private than one in a hospital where everyone already knows your call sign. Emily's jaw tightened. What does he want? To talk about your security situation. "I don't have a security situation." Brannigan tilted his head slightly. "You received a call 47 minutes ago from an unregistered number. 2 rings, no message. That number was routed through a server in Islamabad before it bounced to a relay in Frankfurt. That's not a wrong number, Miss Carter. That's someone mapping your location." Emily's hand tightened around her keys. The metal bit into her palm. "Who?" she asked. 1 word. Flat. No fear, just operational. "We don't know yet, but after last night your name surfaced in channels we monitor. Not your real name, your call sign. Someone ran a search pattern on Death Star within hours of the incident at this hospital. That means someone inside this building talked to someone outside this building, and that information reached people who have been looking for members of your team since Kandahar." Emily felt the ground tilt beneath her. Not physically, emotionally. 3 years of building a new identity, a new life, a quiet existence where nobody knew and nobody asked. Gone. In one night, because a man she cared about was dying and said her name. "Where's the Admiral?" she asked. "Waiting, whenever you're ready." Now, 4:22 p.m. Brannigan drove. Emily sat in the passenger seat and watched the streets of Houston slide by and said nothing for 11 minutes. When they pulled into the parking lot of a nondescript office building in the medical center district, she finally spoke. "How long have you been watching the hospital?" "Since 4 a.m. And you didn't think to tell me sooner?" "The Admiral wanted to confirm the threat level before we made contact. We confirmed it at 2:30 p.m. I was at your car by 3:45. And in that window, someone already pinged my phone." Brannigan looked at her. "Yes, they're fast. Whoever they are, they have resources." Emily got out of the car and walked into the building. Brannigan led her down a hallway, through a door that required a key card, and into a room that had no windows and smelled like recycled air and coffee that had been sitting too long. Whitaker was there, standing, hands clasped behind his back. He turned when she entered, and the look on his face told her everything she needed to know before he said a word. "Sit down, Emily." "I'll stand. This is going to be hard to hear." "I've heard hard things before. Talk." Whitaker nodded. "After Kandahar, when the operation went sideways and you lost Martinez and 2 others, the investigation determined that the ambush was facilitated by a local asset who sold your team's position to a Taliban-affiliated network. That asset was never found. The network scattered. Case went cold. I know all of this. What you don't know is that 18 months ago, that network resurfaced. Different name, different leadership, but the same people. And they've been running a slow search for the surviving members of your team. Not for revenge, for leverage." Emily's blood went cold. She didn't show it, but her pulse, which she monitored the way most people monitored the time, jumped from 62 to 88 in 4 seconds. Leverage for what? Your team operated in areas and accessed intelligence that certain parties would pay a great deal to understand. The surviving members, you, Maddox, and 1 other, represent living knowledge of operations that remain highly classified. If any of you were taken, the intelligence value would be significant. "Taken," Emily repeated. "You mean captured." "I mean abducted, on American soil if necessary. These aren't cave fighters anymore, Emily. They've evolved. They have funding, they have Western operatives, and they have patience." Emily stood perfectly still. The room hummed with the sound of air conditioning and the weight of everything Whitaker had just said. "The phone call," she said, "was likely a location confirmation. They ping a number to see if it connects to a tower in a specific area. Now they know you're in Houston. So I move. Moving doesn't solve this. They'll track you again, especially now that your call sign is circulating in open channels. A hospital full of people who know your name is a hospital full of leaks." Emily's voice dropped, not in volume, in temperature. "Then what are you suggesting?" "I'm suggesting you come back." "Back where?" "Into the fold, under protection, officially, not as a combat medic, not as an operator, as a protected asset with full security infrastructure, new identity if needed, relocation, cover. A cage, a safe house. Same thing with better furniture," Whitaker sighed. "Emily, I've known you for 7 years. I watched you save men in conditions that would break most people. I watched you walk away after Kandahar, and I respected that choice even though it hurt the command to lose you. But this isn't about choice anymore. This is about survival. It's always about choice, Admiral. That's the one thing Kandahar taught me that the Navy didn't." She paced the room, 3 steps one way, 3 steps back, thinking, processing, the way she processed in the field, fast, clinical, ruthless with herself. "Does Maddox know about the phone call?" "Not yet. Don't tell him. He has a right to. He'll try to protect me. He'll discharge himself from that ICU bed with staples still in his leg, and he'll go hunting for people he can't find in a country he can't enter. Don't tell him." Whitaker studied her. "You still know him that well?" "I know every operator I've ever kept alive. It's my job to know them. And Rook's first instinct has always been to put himself between the bullet and someone he cares about. That instinct is why he's in the ICU right now. Fair point. Emily stopped pacing. She faced Whitaker directly. Give me 48 hours. For what? To handle my affairs, finish my shifts, talk to the people I need to talk to. And then I'll come in, on my terms, not as a protected asset in a box, as a consultant attached to whatever team is running the counter-operation on this network. Whitaker blinked. You want to come in as an active participant. You said they're hunting the surviving members of my team. That means Maddox, that means me, and that means Griggs. Something shifted in Whitaker's expression when she said that name. Something quick and dark. You know about Griggs? He asked carefully. I know he was the third survivor. I know he went dark after Kandahar. I know the command lost track of him. She paused. What aren't you telling me? Whitaker looked at Brannigan. Brannigan looked at the floor. Admiral, what aren't you telling me about Griggs? Whitaker sat down. For the first time since she'd known him, he looked old. Griggs didn't go dark because he was hiding, Emily. Griggs went dark because he flipped. The word hit her like a bullet to the chest. What? 6 months ago, NSA intercepted communications between the network and a Western operative using encrypted channels consistent with DEV-GRU training. Voice analysis confirmed it. Griggs has been working with the people who sold out your team in Kandahar. We believe he made contact with them within a year of the ambush. Emily grabbed the back of a chair. Her knuckles went white. That's not possible. I wish it weren't. Griggs carried Martinez out of the kill zone. He took 2 rounds doing it. He was one of us. He was, until he wasn't. We don't know his motivation, money, ideology, trauma, coercion. All we know is that the network has a former Tier 1 operator feeding them information, and that operator knows your face, your habits, your training, and your tendencies. Emily's vision blurred, not from tears, from the kind of rage that doesn't scream. The kind that goes quiet and cold and starts calculating. Griggs is the reason they found me, she said. We believe so. He would have known your fallback patterns, where you'd go, how you'd hide. He probably narrowed their search to Texas within months of your departure. And you're just telling me this now? We confirmed it 6 months ago. We've been trying to locate him since. We haven't succeeded. 6 months. Emily's voice cracked for the first time. Not with sadness, with fury. You knew for 6 months that a traitor from my team was feeding my location to the people who killed Martinez, and you didn't warn me? We didn't know your location, Emily. You disappeared. Completely. We couldn't warn someone we couldn't find. And now you found me because a wounded SEAL blew my cover in a trauma bay. Yes. Emily released the chair. She stood straight, breathed in through her nose, breathed out through her mouth. 4 seconds in, 4 seconds out. The breathing pattern she'd taught to every operator she'd ever worked with to manage stress, fear, and the urge to do something violent. 48 hours, she said again. Then I come in. And when I do, I want everything you have on Griggs. Every intercept, every movement pattern, every associate. Emily, this isn't your operation. It became my operation when they called my phone, and it became personal when you told me Griggs is the one holding the knife. Whitaker stood. He looked at Brannigan. Brannigan gave a single, slight nod. 48 hours, Whitaker said. Not a minute more, and you carry a secure phone. Non-negotiable. Fine. Brannigan reached into a bag and produced a black phone. Military-grade encrypted. Emily took it, turned it on, checked the signal, and put it in her jacket pocket. One more thing, Whitaker said. Maddox's surgery, what you did in there, finding that bleed, you saved a life that is extremely valuable to national security, that hasn't gone unnoticed. I didn't do it for national security. I did it because he's my friend, and he was dying. I know. That's why it mattered. Emily turned to leave. She made it to the door before Whitaker's voice stopped her one final time. Emily, the night of Kandahar. Martinez. I've read the after-action report 100 times. There was nothing you could have done differently. The ambush was set before your team crossed the threshold. Martinez was dead the moment Griggs sold your position. You need to hear that. Emily's hand rested on the door handle. She didn't turn around. I hear it, Admiral. I've heard it 1,000 times. From counselors, from commanders, from the voice in my head at 3 a.m. But hearing it and believing it are two different things. And I haven't gotten there yet. She opened the door and walked out. 5:38 p.m. Brannigan drove her back to the hospital garage. She got in her own car, a 10-year-old Honda Civic with Texas plates, and nothing inside it that would identify who she really was. And she sat there for 5 minutes without starting the engine. Griggs, Tom Griggs, Staff Sergeant, call sign Blackjack. The man who could make anyone laugh in the middle of a firefight. The man who'd held Martinez's hand while Emily worked on the chest wound, telling jokes about a bar in Virginia Beach until Martinez stopped breathing. The man who'd cried at the memorial and hugged Emily so hard she thought her ribs would break. That man was now working with the people who had killed their teammates. Emily started the car. She drove to her apartment, a small one-bedroom in a quiet complex near the medical center. She locked the door, sat on the edge of her bed, and for the first time in 3 years, she cried. Not for long, 4 minutes, maybe 5. The tears came hard and fast and silent, the way they always did, the way she'd learned to cry in places where noise could get you killed. She cried for Martinez, who died at 29 with a photo of his daughter in his vest pocket. She cried for the 2 other teammates who never made it out of that valley. She cried for the version of Griggs she'd known, the version that was apparently dead, replaced by something she couldn't understand. And then she stopped. She wiped her face. She went to the kitchen. She drank a glass of water, and she began to think. 6:15 p.m., her secure phone rang. She answered. Carter. It's Brannigan. We've got a development. The phone number that pinged yours this afternoon has been traced to a burner purchased in Houston 4 days ago. Emily's stomach dropped. 4 days ago, before Maddox even arrived at the hospital. Correct, which means they weren't responding to last night. They were already here, already watching. Last night just confirmed what they already suspected. They've been surveilling the hospital. That's our assessment. We're pulling security footage from the surrounding blocks now. But Emily, if they've been here 4 days, they may already know your apartment, your vehicle, your routine. Emily looked at her front door, the lock she'd installed herself, the deadbolt that she checked 3 times every night, the window she'd positioned a mirror beside so she could see the parking lot from her bed. Habits, operator habits, the kind you never lose because losing them means dying. I'm not running, she said. Nobody's asking you to run. We're asking you to be aware. I've been aware since the phone rang. Tell Whitaker the 48 hours still stands. I have things to do. She hung up. 6:34 p.m. She drove back to the hospital, not because she had a shift, because she had something to do that couldn't wait. She took the elevator to the ICU. The military guards at Maddox's door recognized her and stepped aside without a word. She walked in and closed the door behind her. Maddox was awake. He was watching the news on a muted television, his face tight with the particular frustration of a man who was used to moving and couldn't. He saw her, and his expression changed immediately. Not a smile, something more careful. He'd spent enough years reading people to know when someone was carrying weight. What happened? He said. Nothing. Liar, sit down, talk to me. Emily sat. She looked at him, at the bandages, at the IV lines, at the monitors that showed a heart beating steady and strong because she had found the bleed that would have stopped it. I need to ask you something, and I need the truth. Always, when you said my call sign in the trauma bay, did you think about what that would mean for me? For my cover? For my safety? Maddox's face tightened. The guilt was instant, invisible, and he didn't try to hide it. I thought about you walking out that door and me dying on the table. That's not an answer. Yes, it is. It's the only answer I had in that moment. I was bleeding out, Em. I had seconds. And the only thing I knew for certain was that if you left that room, I was done. So I said the only thing that would make them keep you. And now my location is compromised. My identity is burned. And people I spent 3 years hiding from know exactly where I am. Maddox went pale. Paler than he'd been on the gurney. What are you talking about? I can't tell you the details, but I need you to understand that what happened last night had consequences beyond this hospital. Maddox tried to sit up. Pain shot through his leg and he grabbed the rail. Emily, if someone is threatening you because of what I did, stop, lie back down. I won't lie down while you tell me. You will, because you're 3 staples and a prayer away from reopening that femoral, and I'm not fishing around in your leg again. Maddox stopped. He lay back, but his eyes were burning. Tell me who. I can't. Then tell me what I can do. Emily looked at him, at the man who had taken a blast in 2 bullets and still grabbed a surgeon by the wrist and fought for her right to stay in the room. At the man who had said her name when he should have been saving his breath for breathing. You can heal, she said. You can get out of this bed, and when the time comes, you can be ready. Ready for what? Emily stood up. She leaned over the bed and pressed her forehead against his. Just for a second, the most intimate gesture she'd allowed herself in 3 years. She could feel his breath on her face, smell the hospital antiseptic mixed with something underneath that was just him, familiar and painful and real. Ready to be Rook again, she whispered. She pulled back. Maddox's eyes were wet. He didn't blink, didn't look away. I'll be ready, he said. Whatever it is, whoever it is, I'll be ready. Emily walked to the door. She paused with her hand on the handle. 48 hours, Chief. Then everything changes. She left without looking back. And in the parking lot across the street from Memorial Hermann Hospital, in a rented sedan with tinted windows and no plates, a man with a military haircut and a scar across his left eyebrow lowered a pair of binoculars and picked up a phone. He dialed a number from memory. Confirmed, he said. Death Star, she's still here. The voice on the other end was American, calm, familiar, a voice Emily Carter would have recognized instantly because she'd heard it tell jokes in a firefight and hold a dying man's hand and cry at a memorial for teammates he had betrayed. Good, said Tom Griggs. Keep eyes on her. I'm on my way. Griggs landed in Houston at 9:14 p.m., 41 hours before Emily's deadline with Whitaker expired. He came through George Bush Intercontinental on a Canadian passport under the name David Mercer. Clean shave, ball cap, glasses he didn't need. He walked through baggage claim like any other business traveler, collected a single black duffel from the carousel, and stepped into the pickup lane where the man with the scar across his eyebrow was already waiting in the rented sedan. Griggs got in the passenger seat. He didn't greet the driver. He didn't make small talk. He pulled a tablet from the duffel and powered it on. Show me everything. The driver, whose name was Harkin, handed him a folder. Photographs, surveillance logs, a map of the medical center district with 3 locations circled. Emily's apartment, the hospital, and a coffee shop 2 blocks from the hospital where she stopped every morning at 5:45 a.m. before her shifts. Griggs studied the photographs. Emily in her scrubs, walking through the parking garage. Emily at a nursing station, writing in a chart. Emily sitting in her car in the hospital lot, alone, staring straight ahead. He looked at that last photo for a long time. She looks tired, he said. Harkin said nothing. She always looked tired after a mission, even when she wouldn't admit it. Martinez used to say she'd sleep standing up if you let her. Harkin still said nothing. He wasn't paid to talk about the past. He was paid to watch and report In Drive. Griggs closed the folder. What's the security picture? 2 military guards on the SEAL in the ICU, rotating shifts. Admiral Whitaker has a team in the area, but they're small. 3, maybe 4 operatives. They made contact with her this afternoon, drove her to a meeting in the medical district. She was inside for 47 minutes. They told her. Likely. Griggs leaned back in his seat. He looked out the window at the Houston skyline. Somewhere in this city, a woman he'd served beside for 4 years, a woman who'd saved his life twice, a woman whose voice was the last thing he'd heard before blacking out in a valley in Kandahar, was preparing for him. And she didn't even know what he actually wanted. 10:02 p.m. Emily was in her apartment. She had moved the furniture, not dramatically, just enough. The couch shifted 2 feet to the left, creating a clear sightline from the bedroom door to the front entrance. The mirror by the window angled to cover the parking lot and the sidewalk approach. A kitchen knife, 8-inch blade, placed in the drawer nearest the hallway. Not because she expected to use it, because not having it available was a luxury she could no longer afford. Her secure phone sat on the kitchen counter. She'd called Brannigan once since returning home. He confirmed Whitaker's team had eyes on her building. 2 cars, 4 operators, rotating positions. Anyone approaches will know, Brannigan had said. And if they're already inside the perimeter? Brannigan had paused. Then we'll know slightly later. Emily didn't sleep. She sat on her bed with her back against the wall and her eyes open, and she waited for morning. Not with fear, with the cold, patient focus of someone who had spent years waiting in the dark for things that wanted to kill her. At 2:17 a.m., her secure phone buzzed. Brannigan. Movement. A vehicle circled your block 3 times in the last 20 minutes. Dark sedan, no plates. It's parked now, 200 meters east of your building. How many inside? Thermal shows 2. Emily stood up. She went to the window, adjusted the mirror. She couldn't see the sedan from her position, but she could see the street it would have taken to get there. Do not engage, she said. Let them sit. If they're watching, I want to know for how long. If they move toward the building, call me. Copy. She put the phone down and stood in her dark apartment and breathed. Griggs was here. She could feel it the way she'd always been able to feel when something in the field shifted. Before Kandahar, she would have called it instinct. After Kandahar, she called it scar tissue. The part of you that never heals all the way, that stays raw and sensitive, that picks up vibrations other people miss. Tom Griggs, Blackjack, the man who'd been her teammate, her friend, her brother in everything but blood, the man who'd betrayed them all. And now he was 200 meters from her front door. 5:30 a.m. The sedan was gone. It had pulled away at 4:08 a.m., Brannigan confirmed. Emily showered, dressed, and drove to the hospital. She didn't stop at the coffee shop. She went straight to the staff entrance, badged in, and changed into scrubs. She had 22 hours left before Whitaker's deadline. She clocked in for a shift she'd volunteered for, not because she was scheduled, because the ER was short-staffed, and because she needed to be inside this hospital, around people, in a building with security cameras and locked doors and military guards 2 floors up, and because there was one more thing she needed to do before everything changed. 6:47 a.m. She found Danny Lou in the residence lounge. He was asleep on a couch with a textbook open on his chest. She knocked on the doorframe. He jerked awake. What? I'm up. He saw her. Emily, hey, what time is it? Early. I need to talk to you. Danny sat up, rubbing his eyes. Sure, what's going on? Emily sat across from him. She folded her hands in her lap, the same posture she'd held at Maddox's bedside. Controlled. Intentional. I'm leaving the hospital, Danny. His face fell. What? When? Soon. Today, probably. Tomorrow at the latest. Why? Because of what happened with Caldwell? Because he submitted the review and he's trying to... It's not about Caldwell. It's about something I can't explain. I need you to accept that. Danny stared at her. She could see him trying to put pieces together. The military call sign, the admiral, the guards in the ICU, and now a sudden departure that she couldn't explain. Are you in danger? Emily looked at him. He was young, 27, maybe 28, smart and scared and full of potential that would either be realized or crushed, depending on what kind of doctor he chose to become. She liked him. She didn't like many people. Danny, when I'm gone, and when this hospital goes back to normal, I need you to remember something. What happened in that OR, when I spoke up about the bleed, that wasn't because I have a call sign or a classified background. It was because I paid attention. That's it. That's the whole secret. I paid attention and I spoke up when it mattered. You make it sound simple. It is simple. It's just not easy. Easy would be staying quiet and letting the surgeon be wrong and going home at the end of your shift without carrying the weight. Simple is saying, I see something and I'm going to say it, even if the person above me doesn't want to hear it. Danny nodded slowly. You're telling me to be braver. I'm telling you that you already are. You just haven't let yourself know it yet. She stood up. Danny stood with her. Will I see you again? He asked. I don't know, but if you remember one thing I've said, remember this. The patient doesn't care about your title. The patient cares about your courage. Be the doctor who speaks up. Every time, no matter who's listening. She put her hand on his shoulder, squeezed once, and walked out. Danny stood there in the empty lounge with a textbook in his hands and something burning in his chest that felt like purpose. 8:15 a.m. Caldwell was in his office when he saw Emily walk past his door. He called out, Emily! She stopped, stepped back, looked at him through the doorway. I heard you volunteered for a shift today. ER was short. The ER is always short. You volunteered because you wanted to be here. Emily didn't deny it. Is there something you need, doctor? Caldwell stood up from his desk. He walked around it and stood in front of her. Not close, respectful distance, but facing her directly, the way he hadn't done the first time they spoke in this hospital. The protocol review was approved this morning. Full implementation begins next month. Open challenge system. Cross-disciplinary communication training, mandatory team debriefs after every critical activation. Good. I'd still like your help designing the program. I might not be here to do that. Caldwell's expression shifted. You're leaving? Possibly. Because of what I did? No, because of who I am. Some things from my past are catching up, and I might need to deal with them. Caldwell studied her. And in that moment, he did something he hadn't done the night of the surgery, or in the break room, or in the board meeting. He saw her, not as a call sign, not as a mystery, not as the nurse he'd humiliated. He saw a person standing in front of him who was tired and strong and carrying something heavy and asking for nothing. If there's anything this hospital can do, he said, anything I can do. Emily looked at him. You're already doing it. The protocol changes. That's the legacy of what happened here. Make sure it sticks. Make sure it outlasts the story. I will. And Caldwell, next time a nurse tells you something in a trauma bay, listen. Not because she might be special operations, because she might be right. He nodded. There was nothing left to say. She turned and walked toward the elevator. He watched her go and felt something he hadn't felt in 15 years of being the smartest person in every room he entered. Humility. 9:30 a.m. Emily went to the ICU. The guards let her through. She walked into Maddox's room and found him sitting up in bed, fully awake, arguing with Marcus about food. I don't want Jell-O. I want eggs. Real eggs. The kind that come from a chicken, not a packet. Hospital dietary is very specific about, Marcus, I love you, brother, but if I eat one more cup of green Jell-O, I'm going to stage a tactical extraction from this ICU and find a Waffle House. Marcus saw Emily in the doorway and looked relieved. Thank God. Maybe you can talk to him. Doubtful, Emily said. He's been impossible since 2009. Maddox grinned. 2007. Give me credit. Marcus excused himself. Emily closed the door. Maddox's grin faded. He read her face the way he'd always read her face, like a map he'd memorized years ago. You're leaving, he said. Yes. When? Today. Maddox's hand found the bed rail. His grip tightened. Where? I can't tell you. Can't or won't? Both. Emily. Ryan. The use of his real name stopped him. She never used it. In 4 years of serving together, she'd called him Rook, Chief, Maddox, Idiot, a few words significantly worse than that, but never Ryan. Whitaker told me everything, she said, about the network, about the surveillance, about Griggs. Maddox's face went hard as stone. Griggs. He told you about Griggs? He did. That son of a... Maddox yanked at the IV in his arm. Emily grabbed his hand. Stop it. This is exactly what I told Whitaker you'd do. He betrayed us, Em. He sold our team. Martinez is dead because of him. Cooper, Reeves, dead. Because Griggs gave up our position for money or ideology or whatever the hell his reason was. And now he's coming for you? He's already here. Houston. He arrived last night. Maddox tried to swing his legs off the bed. Emily pushed him back with both hands flat on his chest. The monitors spiked. Listen to me. Listen. You cannot help me from this bed. You cannot protect me with staples in your leg and one working kidney. What you can do is heal. Get strong. And when this is over, when I've dealt with it, you'll be standing on your own 2 feet. That's how you help me. I can't just lie here while... You can and you will, because I need you alive more than I need you brave. And right now, alive means staying in this bed. Maddox stared at her. His chest was heaving. His blood pressure was climbing. And his eyes, the same eyes that had locked onto Caldwell in the trauma bay and refused to let go, were glistening. I just got you back, he said, his voice cracked. 3 years. 3 years I didn't know if you were alive or dead. And I just got you back and you're walking out that door again. Emily's hands were still on his chest. She could feel his heartbeat under her palms. Fast, strong, angry and afraid and alive. I'm not disappearing this time, she said. I'm coming back. Promise me. I don't make promises I can't guarantee. Then lie to me. Emily leaned down. She pressed her forehead against his, the same gesture from the night before, and she held it longer this time. 5 seconds. 10. Long enough to feel his breathing slow, long enough to feel his heart rate drop under her hands. I promise, she whispered. She pulled back. Maddox's hand came up and caught her wrist. The same grip he'd used on Caldwell, but different, gentle, desperate. Kill him, Maddox said. Whatever it takes. You find Griggs and you end this. Emily removed his hand from her wrist. She placed it on the bed rail. She straightened up. Goodbye, Rook. Don't say goodbye. Say, see you later. See you later, Chief. She walked out of the ICU. She didn't look back. She couldn't. Because if she looked back, she would stay. And staying meant waiting. And waiting meant Griggs chose the time and the place. And Emily Carter had learned in Kandahar that letting someone else choose the battlefield was how people died. 10:15 a.m. She took the elevator to the ER, her last stop, the place where everything had started 34 hours ago. Trauma Bay 3. The bay where a surgeon had grabbed her arm and thrown her out. The bay where a dying SEAL had said her name and changed everything. She stood there for a moment, just a moment. Then she walked to the charge nurse's desk, where Lorraine was starting her day shift. Lorraine, Emily, I heard you're on the ER rotation today. I am, but I need to let you know, this might be my last shift. Lorraine looked at her over her glasses. 19 years in emergency medicine had made this woman unshockable. But something in Emily's voice, something final and certain, made her set down her coffee. Personal reasons? Yes. Is there anything I can do? Assign me to Trauma Bay 3. Whatever comes through those doors today, I want to work it. Lorraine studied her, then nodded. Bay 3 is yours. Emily clipped her badge to her scrubs, checked the supply cart, verified the crash cart, pulled on gloves, and waited. 11:22 a.m., the first patient came in, a construction worker with a nail through his hand. Emily cleaned the wound, stabilized the nail, prepped him for imaging. She talked to him calmly, told him he'd be fine, held his other hand when the pain made him shake. He never knew that the nurse treating him had once performed the same procedure in the back of a moving helicopter. 12:07 p.m., a car accident, 3 patients, a teenager with a broken collarbone, a mother with glass embedded in her forearm, and a 4-year-old girl in a car seat who was screaming with fear, but miraculously unhurt. Emily took the child. She held her while the other nurses worked. She sang something soft and nonsensical until the screaming turned to hiccups, and the hiccups turned to silence. Brenda watched from across the bay. She'd heard the rumors about Emily leaving. She didn't say anything. She just watched this woman hold a stranger's child and thought about all the things that call signs and classified files could never capture. 1:15 p.m., a cardiac arrest, elderly man, 78 years old, brought in by his wife who was sobbing in the hallway. Emily ran the code, chest compressions, defibrillator, epinephrine, 4 rounds, 6 minutes of trying. The monitors stayed flat. The man was gone. Emily called it. Time of death, 1:21 p.m. She pulled the sheet over him. She washed her hands. She walked into the hallway and sat with his wife and held her hand and said, I'm sorry, and I'm here, and take all the time you need. The wife gripped her hand so hard it hurt and cried into Emily's shoulder. And Emily held her without moving, without checking her watch, without letting go. Because that's what she did. That's what she'd always done. Held the line, held the people, held everything together so others could fall apart safely. 2:30 p.m., her secure phone buzzed. She stepped into the supply room. Brannigan. We've identified Griggs. He's in a hotel 6 miles from the hospital. Whitaker is assembling a team. We move tonight. I want in. Emily, I want in. That was the deal. A pause. Whitaker says you can be on the tactical briefing. We're meeting at 1800 at the same location. Be there. I'll be there. She put the phone away, went back to the floor, finished her shift. Every patient, every chart, every medication. She didn't leave early. She didn't skip a single task. Because the work mattered. It always mattered. And she would not let the last thing she did in this hospital be anything less than complete. 4 p.m., she took off her badge and held it in her hand. Emily Carter, RN. She ran her thumb over the name. The name was real. The title was real. Everything she'd done in this hospital for 6 months was real. And it mattered as much as anything she'd done in a combat zone. More maybe, because nobody had ordered her to be here. She'd chosen it. She put the badge in her locker, changed into civilian clothes, and walked out of Memorial Hermann for the last time. 4:45 p.m. She drove to the meeting point. Brannigan was waiting. So was Whitaker. So were 4 operators she didn't recognize, but whose posture and silence told her everything she needed to know about who they were. Whitaker briefed the team. Griggs was in a hotel on the west side. 1 associate with him, Harkin, former private military. The plan was simple: contain and extract. Take Griggs alive. He had intelligence value that outweighed the satisfaction of anything else. Emily listened. She studied the maps. She asked 3 questions, all tactical, all precise. When the briefing ended, Whitaker pulled her aside. You don't have to be on the entry team. Yes, I do. Why? Because he'll be expecting strangers. He won't be expecting me. And when he sees my face, he'll hesitate. Griggs always hesitated when it was personal. That hesitation is your window. Whitaker looked at her for a long time. You're using yourself as a psychological weapon. I'm using the only advantage we have. He knows your operators. He was trained by the same people. But he doesn't know how to face me, not after what he did. Whitaker approved it. 9:47 p.m. They went in quiet. 4 operators at the exits. Brannigan on overwatch. Emily and 2 team members at the door of room 614. The lock was breached in 3 seconds. The door went open. Harkin was at the desk. He reached for a weapon. He never got there. 2 operators had him face down on the carpet before his hand touched metal. Griggs was standing by the window. He'd heard them coming. Of course he had. He was Tier 1. You don't surprise Tier 1. But he didn't run. He didn't fight. He stood there with his hands at his sides, and he watched the door. And Emily walked through it. The room went still. Griggs looked at her. 3 years since they'd seen each other. 3 years since a valley in Afghanistan where everything ended and everything began. His face was thinner, harder, but his eyes were the same. Dark, quick. The eyes of a man who could read a room in half a second. But right now those eyes were reading her, and what they found made them widen. He said, don't call me that. I didn't want this. You chose this. Every step, every phone call, every piece of information you sold. You chose it. You don't understand what happened after Kandahar, what they offered, what they threatened. Martinez had a daughter. Did you think about that when you sold our position? She was 3 years old. She'll grow up without a father. Cooper had a wife and a baby on the way. That baby has never heard his father's voice. And you stood at their memorial and you cried. You cried, Tom. Was that real? Was any of it real? Griggs's face crumbled. Not the performance of a man trying to gain sympathy. Something deeper. Something broken at the foundation. All of it was real. That's the part you'll never understand. All of it was real, and I did it anyway. Emily stared at him. And in that moment, she understood something she hadn't expected to understand. She understood that Griggs wasn't a monster. He was something worse. He was a man who'd loved his team and betrayed them anyway. And there was no box in her mind where that made sense. There never would be. Put your hands behind your back, she said. Emily, I need you to know. Put your hands behind your back, Tom. It's over. Griggs looked at her. His hands shook. His lip trembled. And then he put his hands behind his back. Emily stepped forward. She placed the restraints on his wrists. She leaned close to his ear, so close that only he could hear. You don't get to carry their names anymore, she whispered. Martinez, Cooper, Reeves. Those names belong to us. Not to you. Never again to you. She stepped back. The operators took him. He went without resistance. His head was down. His shoulders were broken. Not from the restraints, from the weight of what he'd done finally landing in the presence of the one person whose judgment he couldn't escape. 10:22 p.m. Whitaker met her in the hallway outside the room. It's done, he said. I know. How do you feel? Emily looked at her hands. Steady. Always steady. The hands that had saved Maddox, held a dying man's wife, caught a screaming child, and just restrained the man who destroyed her world. I feel like I want to go to work tomorrow, she said. Whitaker frowned. Work? Where? A hospital. Any hospital. Somewhere with an ER and a night shift, and patients who need someone to show up. After everything? After all of this? You want to go back to being a nurse? Emily looked at him, and for the first time in this entire story, she smiled. Not big, not dramatic. The small, quiet smile of a woman who had finally, after 3 years, found her way back to something that wasn't survival, something that was choice. I was never just a nurse, Admiral, and I was never just an operator. I'm both, and I'm done pretending that either one is less than the other." Whitaker nodded, slowly, with the respect of a man who had spent his life around warriors and had just been reminded what the best of them look like. "Where will you go?" "I'll figure that out. But wherever I go, I'll do the same thing I've always done. Show up. Pay attention. Speak up when it matters. And when the shift is over, I'll clock out and go home and sleep, and come back and do it again." She handed him the secure phone. "You won't need to find me again. I'll stay in touch this time. I'll hold you to that." "You should." She walked out of the building, into the Houston night, into the warm air that smelled like rain and city and something like the beginning of something. The next morning, Dr. Ethan Caldwell stood in Trauma Bay 3 and ran the first ever open challenge training session in the hospital's history. Every nurse, resident, and technician in the room was told the same thing. If you see something, you say it. Rank does not override knowledge. Title does not override truth. The patient is the only authority that matters. Danny Liu spoke up 3 times during the simulation. Each time, he was right. Each time, the senior surgeon listened. In the ICU, Ryan Maddox took his first steps with a physical therapist. 4 steps. Painful. Slow. He gripped the parallel bars and ground his teeth and pushed forward because a woman he loved had told him to be ready. And he would be. In a federal facility 200 miles away, Tom Griggs sat in an interrogation room and began talking. Not because they broke him, because the weight of what he'd carried had finally broken itself. He talked for 11 hours. He gave up everything. Networks, names, routes, accounts. And when they asked him why, he said one sentence. "Because she looked at me, and I couldn't lie to her anymore." And somewhere in America, in a hospital that nobody will ever know the name of, on a night shift that nobody will ever write about, a woman in blue scrubs with her hair tied back walked into an emergency room and picked up a chart and got to work. No call sign, no rank, no fanfare, just a woman who chose to show up, who chose to serve, who chose every single night to be the person standing between someone's worst moment and their last. Because real strength doesn't announce itself. It clocks in, it does the work, and it stays long after the applause stops. That is the truth of Emily Carter. That is the truth the world forgets and the battlefield never does. And that is the truth that saved a man's life on a Tuesday night in Houston, Texas, when a surgeon screamed at a nurse and a SEAL whispered a name, and everything changed. Not because someone was powerful, because someone was present.